Thank you very much. I'm going to talk about what Ghana did to achieve the Millennium Development Goal 1. As you probably have heard, Ghana is the first country in sub-Saharan Africa to achieve a Millennium Development Goal. And in our case, this is Goal 1. Basically, this is what the situation looks like. I don't know if you see it as a red line on the screen, but mine is a red line. You can see how poverty has come down over the years. And if we follow this trend, by 2015, we would more than have met the Millennium Development Goal 1. Not only has extreme poverty come down, but also general poverty has also reduced. And that's the trend goes down. Now, if you also look at child undernutrition, which is again the red line, you see the trend we are following. We have from where we started in 1988 to where we are now. If we continue to follow the trend, we would more than have met that requirement again by 2015. So the question is, what did Ghana do? I first of all would like to talk a little bit about agriculture and its importance to Ghana. Agriculture contributes the largest share of the GDP, which is about 38%. Ghana's workforce, we have about 60% of Ghana's workforce involved in agriculture. If you look at total female involved in agriculture, they're about 49%. Ghana can at the moment be said to be largely food sufficient because we produce about 51% of our cereal requirement, 60% of fish requirement, and about 50% of our meat requirement. Now, what did we do right? I think the first and foremost, or the bedrock of Ghana's success, is good governance and national or political stability. I think, and that's my thinking, sinking money into a country that does not have good governance is like pouring water into a basket. Now, what exactly did we do? One of the things that was done was that we looked at agriculture, because if you look at its contribution to food production, its contribution to income generation, if you can do something about it, you can really move things forward. So Ghana's poverty reduction program focuses on 5 priority areas, one of which is agriculture. And here we modernized our agriculture with strong emphasis on rural agricultural development. There was irrigation improvement, increased production of grains, production of non-traditional cash crops, and also the addition of value to crops were given strong emphasis. Farmers were given subsidies on fertilizers, and also they were given improved seeds, and also tried to reduce costs on plowing and labor to help them carry out their activities. Other activities that we put in place were the school feeding program. The food feeding program is estimated to cover over 1 million children in primary and kindergarten nationwide. I mean, this is a small number compared to the size of India, but for Ghana, covering 1 million school children is quite substantial for us. Now, although this program has the objective of increasing school enrollment and retention, there are direct benefits in improving nutritional status. And the strategy of linking it with local food production also boosts agricultural production and also increased income for poor farmers. Now, some of the strategies that were put in place actually resulted in significant growth in agriculture, increasing from about 4%, annual growth from 4% in 2000 to about 6% in 2005. There are other factors too that were considered. And again, all these factors, I want to emphasize again that good governance and political stability are crucial in making sure that these strategies work. We had a national food fortification program This is to address the micronutrient deficiencies nationwide. We also intensified our infant and young child feeding practices. Exclusive breastfeeding was promoted nationwide. We saw significant increases in exclusive breastfeeding rates. And also, we are also improving our complementary feeding practices. Ghana, through the World Bank, carried out a community-based food and nutrition security program. Now, this program had 3 arms. The arms are, we looked at growth monitoring. It also had a food security component that encouraged backyard gardening, fruit planting, small animal rearing. There was also a microfinance component to this program. This program was carried out in 4 districts and has now been scaled up to about 65 districts. I will not go into the details of this because time will not permit me, but this is also one of the programs that was put in place. There are also other programs. Ghana became HIPIC in 2002, and that means it became a highly indebted poor country. So this came along with some debt reliefs, and the savings from this was plowed into social amenities for the poor, like roads and drinking water, etc. We also put in place a national health insurance scheme. Now, this scheme helped to remove the financial barriers to healthcare access. So poorer households could now pay lower premiums and be able to access the same quality care in public facilities like anybody else could. Then we also had the livelihood empowerment against poverty, popularly known as the LIP program. Now this involved direct cash transfer to poor households by providing safety nets for persons living under extreme poverty. There was also the free maternal health services, and at this, mothers could go to hospital for antenatal care, and also they would deliver in hospitals for free, so they could get good care and safe delivery in these hospitals. Now, having said this, it doesn't mean we've been able to conquer everything. There are challenges. The success regarding reduction of hunger and poverty is not seen in all regions of the country. There are some parts of the country that still have high poverty and high hunger. For example, in the northern regions of the country, we are reporting like food insecurity rates of about 34% compared to about 1% in the greater Accra region, where the capital is located. So there are regional disparities, which we still need to work on. Also, if you look at the way ministries are structured, like the Ministry of Health, the Ministry of Agriculture, you can see that they all run parallel programs. There is really no integration. There is no integration. And I think that if we are to meet the other Millennium Development Goals, especially the health link goals, we must seriously look at this integration, where we can see agriculture serving nutrition and then serving health. So, my message is simple. 2 messages I want to leave with us. If we really want to make an impact, good governance is crucial. Government commitment is very important. Secondly, we must link agriculture, nutrition, and health. This does not come automatically. We need to work at it. We need to forge that relationship to be able to reap benefits and see to it that we attain the other Millennium Development Goals. With this, thank you very much.